met with Dr. Copeland recently to talk about kidney disease, and in particular dialysis, including the different types of dialysis and what this can mean for kidney patients.
So kidney disease has no cure, but dialysis is a treatment that helps do some of the things that healthy kidneys do. Can you tell us a little bit more about what dialysis does?
So you're absolutely right. Kidney disease doesn't necessarily have a cure, but there are lots of things that we can do to treat kidney disease. For people whose kidney function has declined to the point where it's not enough to keep them well, that's where we start to think about using treatments like dialysis. So dialysis isn't a therapy to fix the kidney. Dialysis is a therapy, actually what we term it now is kidney replacement therapy. So it's there to actually replace the work that the kidney's not able to do anymore. So that involves removing fluids, balancing the salts and the electrolytes, removing poisons from the body, and doing the things that the kidney is actually doing quietly in the background. As a sort of a general principle, when people are down into the 6, 7, 8% range of kidney function is when we would usually start dialysis, even if they weren't having any of those symptoms. So we would usually start to consider using dialysis at that point. So it's actually quite remarkable how low people can actually get with their kidney function before we need to start using.
Yeah, that is interesting. And I understand that there are different types of dialysis, I guess primarily two main types. Can you maybe elaborate a little bit on those two types of dialysis? And I guess secondly, how do we determine what type of dialysis a patient would need?
Okay. Yep. So you're right. There's two main groups or two main camps. One is what we call peritoneal dialysis, and one is what we call hemodialysis. So peritoneal dialysis is one where we would put a tube into the tummy just below the belly button, and then we would put fluid into the space in the abdomen, and it would sit there and it would slosh around and it would actually remove the toxins and remove water and do the therapy that we're looking at there. The other one is called hemodialysis, and hemodialysis is where we would typically create a shunt in the arm, where we would take an artery and a vein and put them together, and then we'd put needles in, and we'd run that, we'd take the blood out and we'd run it through a machine, and we'd clean it through an artificial kidney. And I think when most people think about hemodialysis, if they think about hemodialysis, or think about dialysis, they think about hemodialysis. But actually in British Columbia, about a third of the people are doing peritoneal dialysis, and you know, there's benefits and there's problems with both of them. And so the choice of which type of a therapy you go on is largely going to be a patient-driven decision.
And I understand you're a bit of a leader in the home hemodialysis field.
That's how I spend some of my day, yeah.
Can you tell us a little bit more about what's involved in home hemodialysis?
Yeah, and it's a really good point, because actually when I'm sitting in an office with my patient, I actually don't start by saying there's peritoneal dialysis and there's hemodialysis. I actually start by saying, where do you want to do your dialysis? And I start talking to them about doing it at home, doing it in a hospital, doing it in a clinic. We do have another option in British Columbia where we can do home hemodialysis, where we actually take somebody, we teach them how to put in those needles. Hard to believe, but people actually are really good at putting in their own needles. And how to operate the machine. And so they actually learn how to set up the machine, how to respond to alarms that come up on the machine, how to take themselves off, to do some basic maintenance on the machine. So people don't necessarily have to be thinking, I have to go to dialysis and I'll do it in the hospital or in a community unit or something like that. There are options to look at getting them to be able to do it at home as well.
Are there any things that they can do to, I guess, help lead a better life or live well on dialysis? I know you mentioned earlier exercise. Are there any other things you might counsel your patients on in terms of leading a good life while they are on dialysis?
You know, dialysis is associated with some of the dietary changes that we've talked about, and so if people are able to help control their sodium intake, their potassium intake, their fluid intake, that's all beneficial, and that's a tough job actually, just in and of itself.
I can imagine.
So if they can sort of focus on doing that, I think that's a huge help to us as the care providers, because it makes our job easier, which in turn makes their job easier. There are a lot of different medications, and pill burden and the number of medications can be a bit overwhelming for people, but it's worth talking with the care team about, you know, which ones are the most important ones, which ones, you know, to have a look at what you're taking. As long as they're able to help us by taking those pills on a regular basis, which again is a challenge, does make things better.
Well, we are out of time, and that's it today for Ask the Expert, and I'd like to thank you very much, Dr. Copeland, for joining us.
No problem. My pleasure.